Hello, welcome to this month's Health Focus for March. And March is Colorectal Cancer Awareness Month, so we're going to be talking about the importance of getting screened for colorectal cancer. And today I have two guests with me. I have Kathy Olson, who works at ISU, the ISU Nursing Department, and she's a registered nurse. And then Romero Ramirez, who is a colorectal cancer survivor. So I want to first ask Kathy why it's so important for people to get screened for colorectal cancer.
Well, it's so important to get screened for colorectal cancer because if we catch it early, it's a very minor surgery. And if it's caught late, it's major surgery and chemotherapy. So it's just so much easier on the patients if it's caught earlier.
Okay. And then Romero, if you'd like to go ahead and take a few minutes and go ahead and tell us your story and when you were diagnosed, what you went through, treatment, and how you're doing now.
Yes. Basically, my experience with cancer was unexpected. I didn't think that I would get cancer like most people think, you know. What happened was I could start when it first started. I think it was at a basketball game when I was sitting down there coaching, and I had just bought some new white slacks. And after the game, I went home and I took off the slacks and I seen some blood on the back end of my pants. And I didn't think much about it. I just thought it was probably hemorrhoids or something. And I just, you know, I didn't think much about it until days later I started bowel movements, which was bringing out a lot of bright red blood. And at the same time, I didn't think that I still thought it was just probably hemorrhoids. And the thought of cancer never came into my mind. Maybe I was in denial or whatever. But anyway, the blood eventually went away, but going to the bathroom was getting harder. And it probably 4 or 5 months had passed by after the first bleeding or the second bleeding, and I decided to run a half marathon. And when I ran,
What year was this, Romero?
this was back in 2006, I think it was. No, 2007. And what happened was when I was running the half marathon, I started getting tired and sick and nauseated. I just couldn't function right because I had run marathons before and I didn't feel like this. At the end of the marathon, I just passed out, and my wife had to help me back to the car. I went back to the car, and I told my wife, you know, I think I better go get a colonoscopy and check and see what's happening here. And I thought maybe this blood coming out of me was probably maybe something of a sign of cancer. So we arranged a colonoscopy, and I went in, and the doctor found a 3-inch tumor. And needless to say, I was very lucky because there was a surgeon who had an opening for me the next day. I went in, and basically what the surgeon told me, I mean, he told me that I had colon cancer, I have full-blown cancer, and that I needed to get surgery to remove it. And the thing he told me also was, what's going to depend on your condition is if it penetrated. And if it penetrated, you might have to get chemo. So what I did, I went and got my surgery, and I got out of there about 3 days afterwards. They didn't have to put a bag or anything in me. Basically what it was is if people stay in shape, they eat good diet and exercise, you can usually have a better chance to fight any kind of disease, which I think, personally. Well, I got out of there at 3 days, and that was a record for my doctor.
That's very fast.
So I made it in time for a Pokey playoff games, which I wanted to make. I made it there. And a lot of the people didn't think I was going to make it, but I got up there, even though I had some pain pills, but I made it up there. I was determined and not to let something like this stop me, you know, stop my life. So I went, and then about a week later, I had to come back to find out if my cancer had penetrated through the lymph nodes, or, you know. So I went back to a good doctor, Dr. Drew McRoberts, which is a fantastic surgeon. And that's another thing about cancer. if you ever go in for surgery, make sure that you just don't have a good doctor, but an excellent doctor. Because with an excellent doctor, he can usually get everything out. And which he did. He found 14 lymph nodes, and 4 of them were cancerous, and it penetrated through the lymph nodes. And he cut all of them out, and he told me, well, you have to take chemo. I had to take chemo for 7 months. What it was called 5FU, which the long word for that, I can't even pronounce that word, so I call it 5FU. And I took that for 7 months. I had to take a pump with me through a port catheter. The first 3 or 4 months, I had to get it through that way, through the port, and then my last, I think, 5 therapies, they busted. Both of them busted, which was, they couldn't believe it. It was unknown that 2 of them would bust like that. So they put a pick in me, and that helped me out a lot, too. It's a lot easier, I think.
So Romero, can you tell people what a pick is? Because a pick sounds really bad.
A pick is just a tube which they put right through here, through your arm, right here, through the vein, and then goes right into the artery, through your main artery, your heart artery.
It goes up right above your heart, not into the artery,
okay,
though.
yes.
But in that big fat vessel. Right.
So you can dilute, I guess, the chemo a lot better.
Right.
Okay, and plus, every day you have to clean it out with heparin. Compared to the port is just implanted in underneath your skin. And the only thing they do is they clean it out. They clean out the line when you go get your therapy, and then they put a needle in there, and then they set the pump for 2.5 days. And so your home was carrying this pump for 2.5 days. I mean, after 3 or 4 days, you know, you're really sick. After you get it off, you're about 3 or 4 days you're sick. And they give you a nausea pill, which helps you from, you know, throwing up or. So it does help because you get really sick. You get so tired, so sick. It took me about 4 days after the chemo to get right back up. And basically what I would do if I was in bed, I try to move around as much as possible. You don't want to be laying around too much, feeling sorry for yourself, like I was there for a while. And so basically what I did, I'm a coach. I've been coaching for 15 years. And what I decided to do is I was looking at my trophies and I go, you know, I got to stop feeling sorry for myself, get back up, start coaching, get your spirit back up. So what I did is I called up my basketball team. We went out. Even though I had, you know, some of the tournaments, I had just come off chemo, I was determined to just keep going, not let this cancer stop me, you know. If you let it overcome you, then basically I think you'd be done, you know. You have to fight it no matter what, you know. It's something you just can't give up on. So basically what I used was my sports as a way to overcome that. And plus, not just sports, but maybe I'd call it divine interference too, which I believe that a good prayer, a lot of prayer would help out too, you know. And well, after my chemo, I found out that I had other things like high cholesterol, which was leading to a heart attack, and type 2 diabetes. And you could say, well, cancer is bad, but if I wouldn't have got cancer, my chances of not finding out about this other stuff wasn't going to be good. So in a way, I'm glad, you know, that I did get cancer. A lot of people would think, well, that's crazy, but you know, it's really showed me a lot of things about life, you know. Not to give up, to keep going, you know.
So Romero, because of this, what have you done differently then? How do you live your life differently?
Well, I live every day